Brianna French, and today I will be doing my newborn assessment video. I'm just going to work my way from head to toe and get vitals and all of my measurements. So, alright, so first things first, I'm just going to, upon entering the nursery, I hand sanitize, of course, and I'm going to come over to my baby and check armband, make sure I'm doing my assessment on the right child. So I check my armband, date of birth 12/13/2017, and then whatever baby's last name is. Check that. All right. And then first thing, I'm just going to go ahead and I like to get, so if this is like the first blood pressure on the baby, I'm going to go ahead and get that blood pressure using a cuff, and go ahead and I can either do it, wrap it around baby's arm here. I like to do blood pressure first because on baby, because I find that getting them before they're being all messed with and stuff like that, before I get them all angry by moving them around too much, and getting them right while they're calm and relaxed and doing that right off the bat is my favorite thing to do. So I would just push the machine, get my blood pressure on baby, and that was a normal blood pressure. Sometimes the normal blood pressure for a baby can be about anywhere from, let's see here, I think they said 60, a low one would be like 60 systolic, 40 diastolic. Sometimes you get up to like 80 or 90 to over 50, 60. Somewhere in that range is pretty good for a baby. So I did my blood pressure, and then I'm going to go ahead and get my temperature on baby, which I will do by putting it underneath, and I'm getting an axillary temperature. So I just stick that under there, turn it on. And normal temperature for a baby would be 36.5 Celsius to 37.2 degrees Celsius, and baby's 37 degrees Celsius, so that's great. Okay. Next, I'm just going to go ahead and I'm going to get the oxygenation. You can either wrap it around baby's hand here to get the pulse ox, or the foot. And when you're doing that cardio baby assessment test, you would do the hand and the foot and record the difference there. So baby's great. Baby's starting at 100%, pulse is 120, baby is in a good mood. Okay. Next, I'm going to just go ahead and just assess how baby is doing with my NIPS, my pain scale chart here. And baby is showing all signs of no pain. Baby's relaxed, not crying. The breathing is normal, 30 to 60 I can see that. I can check her respirations to verify that. Her arms and legs are relaxed. She's calm and awake. So now I'm just going to go ahead and count respirations for 1 whole minute. I can do this by either listening with my stethoscope or placing my hand on baby's abdomen and counting the respirations. So I would do that for 1 whole minute, and baby is between 30 and 60 respirations. So that's good. Or I can listen, and baby is in between normal range. So then I'm going to go ahead and I'm going to take a listen to baby's heart. And getting an apical pulse on baby, listening for 1 whole minute. Normal pulse should be, well actually, use the baby stethoscope, the nursery size stethoscope. And then baby's heart rate would be between 110 and 160 beats per minute. And like they said before, if you hear a murmur, those can come and go. So just document that you heard it, but be aware that the next nurse may not, or you coming on may not hear it, whereas it was documented that it was heard by another nurse. So then I'm just going to go ahead and get baby's height and weight, head circumference, and chest circumference. Measuring all these. Baby's head is 14 1/4. Being careful not to, and then I go around the nipple line for the chest here. Perfect. Let's see. It's about 13 for chest. And then what I like to do, I personally like to stretch baby out, put a mark at the top, and then stretch the leg out, put a mark at the bottom, and then measure. But for the sake of this today, I'm just gonna go ahead and stretch baby out, measure, and baby's about 20 inches. And then I would get my scale out, my baby's scale, where if there's one present, and I'm gonna just make sure it's all zeroed out, and then and then put a blanket on it, and then tear the weight of that out, because I want to keep baby warm. So when I put baby on the scale, I want to have a blanket on first, but make sure it's still zeroed out, because I don't want baby to lose any heat through conductive heat loss. Other types of heat loss are radiant, if they're convectional heat loss, which is like a fan, any air that's circulating over the baby. And then evaporation, so like the initial loss of fluid, that the amniotic fluid from the baby can give the baby the chills and cause baby to become a little bit hypothermic. So you just want to keep baby nice and warm. That includes, you know, putting a blanket on that scale and keeping a baby away from any cold surfaces. So maybe before I touch the baby, I warm up my stethoscope with my hands before putting it on baby. Just making sure that everything we do, if my hands are cold, keep them warm. All right, so then I'm gonna go ahead and I also want to check my brachial pulses on my baby. So I'm just gonna feel for those for about a minute and make sure that they're consistent and they're equal. And then I would do the femoral pulses right here on baby, inside that thigh there, and checking for those, making sure those are consistent and equal. Right off the bat, because I'm here, I'm gonna just look at all the fingers and toes. I don't see any webbing, they're all there. None of them are webbed together. They look great. And while I'm doing this, I think I'm just gonna go ahead and do my reflexes as well. So baby is Palmer's grasps. I just stick my pinky in there, baby grasps it. Good Palmer's grasp. The plantar reflex, I just put my finger right here on baby's toes. The baby curls his toes around my finger. And then the Babinski, I just run any object, maybe just a soft edge of a pen, and I would run that pen right up the baby's foot, and they're going to see the finger, the toes flare. And that would be a positive, good Babinski sign. So that's good. And then I just want to check baby's rooting reflex. I'm just going to kind of gently put my finger by its cheek, and it turns towards that. That's for proper feeding, and that's just a reflex that happens with proper feeding. All right. So then I'm going to start from head to toe doing my assessment. First, I'm just going to look over the whole body here. Notice if I notice anything abnormal, any rashes, stork bites, the Epstein rash that occurs that looks like acne, any of the milia, any hair that's on the baby, that hair, what's that called? It starts with an L. So if there's any hair on the baby,